Welcome to the deep dive. Today we're taking a bit of a shortcut, actually.
Oh, yeah.
Yeah, exploring something really foundational. How understanding your body's functional anatomy. Well, it isn't just for textbooks or, anatomy geeks.
Right. It's practical stuff.
Exactly. It's key to unlocking some pretty surprising insights, not just in yoga, but honestly, just moving through your day with, well, more ease.
And for this journey, we're drawing from some great material excerpts from Functional Awareness and Yoga, an anatomical guide to the body in reflective practice. It's by Allegra Romita and Nancy Romita.
Fantastic. And our mission here, we want to use their work kind of like a map to explore how linking functional anatomy with what they call reflective practice can really deepen your understanding of your own unique body. It's not about memorizing Latin terms.
Not at all. It's about feeling how your anatomy works in action, uncovering those hidden movement habits, maybe the ones you don't even know you have.
And finding more of your body's potential that way.
Exactly, making this information really, applicable and engaging for you.
Okay, so at the core of this is functional awareness, or
Yeah.
FA. Lots of people talk anatomy, but what makes this different? What is functional awareness?
Well, they define functional awareness as linking embodied anatomy. That means, feeling and sensing your anatomy as you move in real time
Okay.
with reflective practice. And the main goal, simple, enhance ease in action, whether that's on a yoga mat or, like you said, just walking down the street.
So it's not just head knowledge, it's a felt sense. You feel it.
Precisely, yeah. The book does focus quite a bit on the physical yoga practice, the asanas, but the principles, they absolutely apply off the mat. It uses functional anatomy to deepen your understanding of your specific body structure. For resilience, finding that balance between, flexibility and strength.
And they're clear. It's like a companion guide, right?
Yeah.
Not trying to replace those big anatomy textbooks.
Exactly. It takes that foundational knowledge and helps you actually use it. And one of the really powerful ideas they bring up early on is looking at your daily posture and movement habits. They really stress that understanding these habits, even the totally unconscious ones, like how you sit or stand, maybe even sleep, is fundamental.
That's the starting point.
That's the starting point for changing patterns you don't want and developing new, maybe more efficient ways of moving that can help your body recuperate from, well, just daily life.
Because those little unconscious things, wow, they really add up, don't they?
Oh, absolutely. Over time, these small, repetitive actions can be surprisingly detrimental. They can cause tension, contribute to injury, even chronic pain.
Pain we might blame on something big, like a workout.
Exactly. But it often stems from that daily wear and tear of just inefficient habits.
That example they give really hits home, sitting hunched over a desk all day, spine all compressed, and then trying to jump straight into a deep back bend without any prep. It's like setting yourself up for trouble.
It really sets the stage. And they connect this right back to yoga practice, saying that, mindless practice, just going through the motions, it's a missed opportunity.
Yeah.
But when you bring this awareness to your individual movement patterns, acknowledging what works for your body, it creates this powerful sync between body and mind.
All right.
And that lets you consciously choose maybe better alternatives or modifications in poses.
Awareness brings choice. And choice unlocks potential. I like that.
It does. And speaking of potential, they reference this wonderful phrase from Margaret Lee Runbeck. Balance is not a station one arrives at, but rather as a way of traveling.
Oh, I love that. It's not static, is it? Not some place you get to and just stay.
Exactly. Balance is dynamic. It's constantly shifting, responding to what you're doing, where you are. It's a process.
And this functional awareness approach gives us a framework for that travel and
Yeah.
for this reflective practice. They use the 4 Rs, right?
Yes, the whole process really revolves around these 4 steps: recognize, release, recruit, and restore.
Recognize, release, recruit, restore.
Okay, let's unpack those quickly. What does each one mean here?
Think of it like a cycle. First, you recognize. Just notice what's happening in your body right now. Your posture, maybe a habit of tension, a specific way you move. It's just observation, no judgment.
Okay, observe.
Then, release. Let go of any unnecessary tension you just noticed. Not collapsing, but releasing those holding patterns that aren't really helping.
Let go of the unhelpful.
All right. Then, recruit. This is where you invite more optimal muscle action or better support, better alignment, often guided by the anatomy insights we'll talk about.
Invite the helpful.
Yeah. And finally, restore. Moving towards a greater sense of ease or balance or potential in whatever you're doing. Finding a new, more integrated state for that moment.
So observe, let go, invite, find a new balance. Makes sense.
Exactly. And it's a cycle. You keep revisiting it. It's not just a one-time thing.
Got it. Okay, let's start applying this, starting right at the bottom, the foot and ankle, the foundation. The foot, yeah. It's incredible, really. Each foot has 26 articulating bones, 31 joints. I mean, think about that complexity.
Wow.
It needs to be super stable for weight bearing, but also really resilient and adaptable for, uneven ground.
Like walking on a pebbly beach or something.
Exactly. The main ankle joint, that's a strong hinge formed by the talus bone fitting into the tibia and fibula, your lower leg bones. That mostly does dorsiflexion, pulling toes up, and plantar flexion, pointing toes down.
Okay.
But then the bones further down in the foot, the tarsals, they allow those subtle but vital side-to-side movements. Inversion, rolling the sole inward.
Sometimes called pronation.
Yeah, sometimes. And eversion, rolling the sole outward, or supination. And that ability to invert and evert is crucial for adapting to uneven surfaces.
Right. And arches. People talk a lot about arches, high arches, low arches.
They do, and the book points out some common misconceptions. The medial longitudinal arch, the inner one, gets the most press. But the authors really emphasize that how you use your foot structure is way more important than just how high or low your arch looks skeletally.
So trying to force a perfect arch or gripping with your toes is kind of missing the point.
Totally missing the point. Gripping just creates tension. Instead, they guide you to distribute weight evenly through the whole foot. And they offer this great visualization to help the tripod of balance.
The tripod. Okay, where are the points on this tripod?
Imagine 3 spots on the sole of your foot. One is just behind the ball of your big toe, sort of between the first and second metatarsal heads.
Okay.
Another is just behind the ball of your little toe, between the fourth and fifth metatarsal heads.
Got it.
And the third is right in the center of the front part of your heel bone, the anterior calcaneus.
Okay. Visualizing those 3 points, like a triangle.
Exactly. And just thinking about these points, visualizing them, encourages the small muscles in your foot and even up the leg to engage in a more balanced, supportive way. It's pretty cool. They also highlight 2 key muscles forming a kind of stirrup support for the ankle, tibialis posterior and fibularis longus.
Those run down the sides of the lower leg, right?
They do, on opposite sides. And their tendons actually cross under the arch, creating this muscular stirrup. Our habits, like if we tend to roll in or out a lot, can affect the balance of the stirrup. So visualizing it helps activate that balance support.
Okay, let's use the 4 R's here. How does this work in just standings, like in Tadasana, mountain pose?
Right. In Tadasana first, recognize your usual stance. Where's your weight? Forward, back, more inner foot, outer. Just notice.
Okay.
Then release any tension you find. Maybe you're gripping your toes or your ankles feel tight. Soften your gaze. Bring awareness to that tripod visualization. This lets your body recruit the natural, subtle muscular adjustments needed for balanced, upright posture. And finally, you restore towards feeling more ease and stability.
And what about Warrior 1? That back foot is often a challenge.
Oh, yeah, definitely. A super common cue is root down through the outside edge of the back foot.
Heard that one a million times.
Right. And it can be helpful if you tend to collapse inwards. But the authors point out it can also lead to overdoing it too much inversion, which can create torque going up the leg.
So what's a functional awareness alternative cue?
Try visualizing that tibialis posterior and fibularis longus stirrup in the back foot. Recognize what the foot is doing as it rolling way out. Release the habit of just jamming the outer edge down. Recruit balance support by thinking about that stirrup, encouraging even pressure through the whole foot, including the inner edge and heel.
Using the stirrup image.
Exactly. That helps restore a more stable foundation, which then allows energy to flow more freely up the leg and into the torso.
And you can take this awareness off the mat, too.
Totally. Look at your old shoes. The wear patterns on the soles tell a story about your habits.
Huh?
Notice how you stand in line or sit or walk. Just mentally applying the 4 R's, even just the recognize part, starts to deepen that brain-body connection and can slowly shift things.
Okay, moving up the leg. The knee. They title this section Acceptance and Transference. I like that. Accepting where you are, transferring weight.
It's a great title. The knee, it's the body's largest synovial joint, a modified hinge joint. It's where the femur, the thigh bone, meets the tibia, the shin bone, plus the patella, the kneecap.
And inside?
Inside, you've got the menisci. Those are fibrocartilage cushions, like shock absorbers, helping the bones fit smoothly. And strong ligaments and tendons hold it all together. The patella, the kneecap, is interesting. It's a sesamoid bone, meaning it's embedded within a tendon, the big quadriceps tendon. And it acts like a fulcrum, boosting the leverage of your quad muscles when you straighten your leg.
So mostly bending and straightening, flexion and extension.
Those are the main actions, yeah. But there's also a little bit of medial, inward, and lateral outward rotation possible, which is really important for dynamic movement like walking. And there's something called the screw home mechanism. Yeah, as the knee fully extends, there's a subtle rotation that kind of locks it into a stable position for standing.
Okay. How does functional awareness help us understand our own knees better?
Start with just exploring to recognize your habits. When you're sitting, just notice your knee position. How do your kneecaps track? Do they point straight ahead, roughly over your second toe, or do they tend to angle in or out? Where do you feel tension? Just observe, no judgment.
And like the feet, individual differences are huge here, right? Knock knees, bow legs.
Absolutely huge. They discuss genu valgum, which is knock knees, and genu varum, bow-leggedness. These can be down to your individual skeletal structure, or influenced by muscle development, or even habits starting way down in your feet, like that excessive inversion or eversion we talked about.
Right, it all connects.
It really does. There's a figure in the book, 7.3, that shows the angle of the femur coming down. It really highlights that it's about accepting your unique structure.
And the muscles around the knee are crucial for support.
Oh, definitely. You've got the powerful quadriceps group on the front four muscles there, including the rectus femoris. They extend the knee.
Straighten it.
Right. And the hamstrings on the back, three main ones there. Semimembranosus, semitendinosus, biceps femoris. They flex the knee. That's what you feel stretching in a forward fold. Having balanced strength between quads and hamstrings is key to preventing strain. Sometimes just gently touching these muscles can be a great tactile cue, helps you recognize and recruit them more consciously.
They suggest an exploration to repattern leg action, starting seated.
Yeah, you start by getting those tripod feet grounded, aligning your kneecap, then extend one leg, just notice its angle. Then they suggest using a prop, like a pillow or a yoga block between your thighs.
Tactile feedback.
Exactly. And that leads into the reflective practice in a pose like king chair, which is a variation of Utkatasana chair pose.
How does the block work in Utkatasana?
In king chair, you first recognize your knee's natural tendency, varum, bowed, valgum, knocked, or neutral. The block acts as a tool to help you recruit a more balanced action.
Okay.
If you tend towards varum, bowed legs, gently squeezing the block helps engage your inner thigh muscles, the adductors, bringing the thighs more parallel. If you tend towards valgum, knock knees, the block creates a space, helping you recognize that tendency and then recruit the action of tracking your knees more in line with your feet.
So you use it differently depending on your tendency.
Precisely. You release unnecessary tension, recruit better alignment using the block's feedback, and restore towards balance. Then you take the block away, maybe try Utkatasana with big toes touching, and just notice if anything feels different after that focused awareness.
That direct feedback sounds really effective.
It can be very powerful. And daily life. Notice your knee position when you're driving or riding as a passenger. Is there any weird torque or angle? Apply the 4 R's. Recognize it, release tension, recruit better alignment knee over ankle, tracking towards hip, and talk it. Restore a more comfortable supported position. Small adjustments add up.
Moving up again, pelvis and hip joint. Balance and mobility.
Another absolutely crucial area. This is your classic ball and socket joint. The head of the femur, your thigh bone, fits into the acetabulum, the socket in your pelvis, and that design gives us incredible mobility, flexion forward, extension back, adduction towards the middle, abduction away, and rotation both medially inward and laterally outward.
The book mentions people often mistake where the hip socket actually is. I know I used to think it was further out on the side.
You're definitely not alone. It's a common misconception. People often point to that bony lump on the side, the greater trochanter.
Yeah, that's what I thought.
But the book guides you to find the aces, that pointy bit on the front of your hip bone, and then move inwards medially towards your pubic bone. The actual socket, the acetabulum, is surprisingly kind of midway between the top crest of your hip bone and your pubic bone. Often feels closer to the front and center than you'd think.
Finding that spot.
Yeah, maybe with your thumb. It gives you a much more accurate point of reference for feeling the hip movement itself.
Okay, that visualization helps. And pelvic position is key for hip health, right? The tilt.
Absolutely central. They describe 4 common postural habits for the pelvis. Anterior tilt, where the tailbone lifts and the front drops down.
Like sticking your butt out.
Kind of, yeah. Posterior tilt, where you tuck the pelvis under. Neutral pelvis, which is the balanced position. And forward sway, A neutral pelvis is really the goal for distributing stress most efficiently across the low back, hips, legs. It's what you aim for in poses like Warrior One, Warrior Two, High Lunge. Exploring cat-cow pose is a fantastic way to feel that pelvic mobility range.
What's the embodied exploration they suggest for feeling the tilt?
It's simple but effective. Stand with feet hip distance, knees slightly bent. Place one hand on the front of your pelvis, one on the back. Now, exaggerate an anterior tilt. Lift your tailbone. Feel the front rim tip forward. Notice how that might arch your lower back more. Maybe put pressure on your knees if you straighten them.
Okay.
Then exaggerate a posterior tilt. Really tuck your tailbone under. Feel the opposite sensation, maybe pressure on the back of the hips or flattening the low back curve.
Mm-hmm.
Then find the sweet spot, the balance point between those two extremes. That's your neutral pelvis.
Feeling the extremes helps find the middle. Makes sense. What about the muscles around the hip?
It's surrounded by powerful muscles. For abduction, moving the leg away from the body, and medial rotation, turning the thigh inward, you're mainly using the TFL, tensor fasciae latae, gluteus medius, and gluteus minimus. These connect into that IT band down the side. For lateral rotation, turning the thigh outward, you've got the big gluteus maximus, and underneath it, the 6 deep lateral rotators, including the piriformis. These are crucial stabilizers, especially in strong poses like Warrior Two.
Let's apply that to Warrior Two then. How does visualizing the muscles help there?
Okay, in Warrior Two, first, recognize your pelvic position. Maybe gently explore tilting back and forth to find neutral. Release any tension that's holding you stuck in a tilt. Now, recruit support by visualizing the muscle action. Your front thighs turning out, laterally rotating, visualize the gluteus maximus and those deep rotators supporting that. Your back thigh is subtly rotating in. Medially visualize the TFL, gluteus medius, and minimus helping with that inward thigh spiral.
Visualizing front thigh out, back thigh in.
Right, that helps you restore a sense of integrated stability in the pose. And they really stress again, stable feet are foundational. That tripod, that ankle stirrup we talked about, they help the hips navigate movements optimally. Using props like blocks or blankets under your sit bones in poses like Baddha Konasana, bound angle, or half pigeon, that also helps respect individual hip structure and supports the joint.
And they apply this to Malasana, the deep squat, too.
Malasana is perfect for recognizing your unique hip structure and habits. If you tend to tuck your pelvis way under in a squat, try to release that pattern. Recruit more space for hip flexion by moving towards a neutral pelvis, visualizing the thigh bone head moving smoothly in the socket. They even suggest connecting to your tripod feet and your head balance simultaneously, thinking about support elsewhere.
Free up the hips.
Exactly. It promotes integrated whole body support.
How can we notice hip habits in daily life?
Pay attention when you sit. Do you always lean on one hip? Are your sit bones even on the chair? In bed, do you often pull one knee way up towards your chest? That's a deep hip flexion habit that can create imbalances over time. Recognize these patterns, release the tension, maybe consciously, recruit a different position sometimes, and restore towards balance. It's about having more choices.
Okay, moving up from the base, let's talk about the spine. The book calls it the center of resilience.
Resilience is the perfect word for the spine. It's not meant to be rigid. It's designed for dynamic movement, contracting, expanding, bending, twisting, and bouncing back. They make a great point. No straight lines in the body. The spine has natural curves, even spiral patterns within its structure.
Providing support, but also mobility and protecting the spinal cord.
Exactly. Essential functions. Structurally, it has 4 main sections: cervical spine in the neck, 7 vertebrae, thoracic spine in the mid-back, 12 vertebrae, and these connect to your ribs. Lumbar spine in the low back, 5 big weight-bearing vertebrae, then the sacrum, 5 fused vertebrae, and finally the coccygis, the tailbone, which is also fused.
And those curves are key to the resilience, aren't they?
Absolutely. You've got primary curves, the rounded ones in the thoracic spine and sacrum, the ones we're born with.
Like a fetal position.
Right. And then secondary curves develop after birth in the cervical spine, neck, and lumbar spine, low back, as we learn to lift our head, sit, crawl, stand, walk. These curves counterbalance each other, giving us strength and that dynamic alignment for being upright.
They suggest an embodied exploration for trunk motions. Feeling the spine move.
Yeah, it's a really simple but effective way to feel the spine's potential. Just explore the 6 basic actions: flexion, bending forward; extension, arching back; lateral flexion, bending side to side, right and left; and rotation, twisting right and left.
We could do this seated.
Easily. Seated is great. For flexion, gently nod your chin towards your chest. Maybe let your upper back round slightly. Come back up. For extension, gently lift your chest, arch your back, maybe look up slightly. They suggest returning by bringing the chin slightly forward first to keep the neck happy.
Good tip.
For side bending, let your head lead the way as you lean right, then left. For rotation, maybe soften your chin slightly towards your chest. First, this can release tension where the skull meets the spine, the AO joint. Then gently spiral your torso right, then left. Let the arms follow.
Doing that, you really notice differences side to
They
side.
do. Maybe one side feels tighter or has less range in twisting or bending. Outside of the formal exploration, just pay attention to your everyday posture. Do you tend to habitually lean or spiral one way? That awareness, that's the recognized step. And it's powerful because it opens up choice.
And like other areas, individual spinal shapes vary too.
For sure. Skeletal factors, the shape of your neck vertebrae, your ribs, the spine itself, they all differ. They mention conditions like kyphosis, which is an increased thoracic rounding. Well, an exaggerated curve, yeah. Lordosis, an increased curve in the neck or low back. And scoliosis, which involves a sideways bend and rotation. They make a key distinction. While some conditions are beyond the normal range and need medical attention, many postural tendencies that might look like these can often be improved through yoga and this kind of reflective practice.
Okay. What about key muscles supporting the spine's resilience and movement?
They highlight a deep group called the transversospinalis muscles. These are the rotators, multifidus, semispinalis deep muscles right along the back of the spine. They're mostly type 1 endurance fibers, meaning they're built for constant, subtle work, stabilizing the spine and helping with rotation. They're almost autonomic, constantly firing in response to gravity to keep you upright.
Wow, working all the time.
Pretty much. Then you have the obliques, internal and external, with their diagonal fibers. They provide the power for bigger movements like side bending and twisting. Think of the core power in throwing something. And they make this really interesting connection with the serratus anterior. That's a muscle running from the ribs under the shoulder blade, helping it protract or move away from the spine.
Okay.
They describe how the serratus on one side works with the opposite internal oblique muscle. Together, they create this spiraling diagonal chain that actually helps deepen and integrate twists.
That's fascinating. Serratus and opposite internal oblique. How do we visualize that spiral?
Try this. Sit comfortably and just twist to the right, noticing the feeling and range. Then come back to center. Now twist right again, but this time recruit the action by visualizing, initiating the spiral from your core, maybe feeling the internal oblique on the right side engage. At the same time, release tension by imagining or sensing the left serratus anterior, allowing the left shoulder blade to glide forward, away from the spine, helping the twist.
Visualizing the muscles working together.
Yes. Notice if that visualization changes the quality, the feeling, the integrity of the twist. Restore ease by breathing into it.
So applying this to a seated twist pose, like Ardha Metsyendrasana.
First, set up your foundation. Get grounded through your sit bones. Maybe use a blanket or block if that helps you sit taller. Release any tendency to slump or round your lower back by rocking slightly forward on your sit bones. Use the hand behind you to gently press down, helping you recruit length up through the spine. Find that balanced head position at the AO joint.
Get tall first.
Exactly. Then, recruit that spiral action, visualizing the internal oblique and the opposite serratus anterior working together. As you twist, consciously, release tension in places like your neck or jaw. Restore your awareness to your breath, feeling the dynamic support of your spine in the twist. Do both sides and recognize any differences you feel.
And those daily spinal habits.
Yeah, just notice when you're reading on your phone, at the computer, standing. Are you habitually hunched, overly arched, twisted, leaning? Recognize those patterns. Think about how these daily shapes might be affecting your comfort and range of motion when you get on your yoga mat. Awareness is always the first step.
Okay, let's move to something essential, constant, breathing. The section is titled Inspiration.
Inspiration love the double meaning. Breathing in and finding vitality. Breathing is autonomic, right? It just happens. But it's also incredibly shapeable, controllable. That's what pranayama, conscious breath control, is all about. Functional awareness looks at the experiential anatomy of breathing, helping you understand your own breath better.
They mention visualizing the anatomy, lungs, diaphragm.
Yes, and they point out a common misperception. The tops of your lungs actually extend above your first rib, surprisingly high up near your collarbone.
Really? Higher than I thought.
Yeah. And they only go down to about the fourth or fifth rib, not way down into the belly like some people imagine. Understanding the actual location of your lungs and diaphragm can really shift how you feel and work with your breath.
So an embodied exploration for breathing.
Try this. Place your hands gently on your side ribs, maybe thumbs under your armpits, fingers wrapping around front. As you breathe, just recognize where you feel movement. Can you sense the ribs expanding sideways and maybe slightly upwards on the inhale? Can you imagine breathing right into where your thumbs are, feeling movement high up in the sides? Notice if this simple focus shifts your habitual pattern. It's about honoring your natural breath, but exploring potential. The primary breathing muscle is the diaphragm, that big dome under the lungs, but other muscles help out. The intercostals between the ribs lift and expand the chest. Even deep core stabilizers like the psoas and transversus abdominis play a subtle role. And then you have auxiliary muscles.
Like backups.
Kind of, like scalens in the neck, muscles in the floor of the mouth. These kick in more during really strenuous breathing, like after running a race.
They use ujjayi breath as an example for noticing sensation location.
Right. Ujjayi, the ocean breath, involves a slight constriction at the back of the throat. As you practice it, recognize where you feel the breath sensation most strongly. Is it high in the chest, maybe using more auxiliary muscles? Is it lower, feeling more diaphragmatic? Somewhere in between. There's no single right way. It's an invitation to recognize your patterns and maybe consciously recruit different aspects of the breathing system.
Any daily life breathing reflection.
They suggest paying attention to your tongue position, especially when concentrating or stressed, like when driving. Is your tongue tense? Pressed hard against the roof of your mouth. Release that tension. They propose that bringing awareness to something subtle, like tongue position, often an unconscious habit, can actually influence your whole breathing pattern over time. It leads to more resilience, more choice.
The book uses a really cool architectural metaphor. Muscular domes for support.
It's a fantastic visual. Like domes in buildings, the Taj Mahal, Florence's Duomo provide incredible structural strength. Our bodies have muscular domes offering support and aiding breathing. There are three main interconnected ones.
Okay, what are the three domes?
Lowest one is the pelvic floor. In yoga, often linked to Mula Bandha, the root lock, it's like a muscular hammock stretching from sit bones and pubic bone back to the tailbone, supporting your pelvic organs.
Got it. Lowest dome.
Middle dome is the diaphragm, the primary breathing muscle we just talked about.
Middle dome.
And the highest dome is the soft palate. That's the fleshy part at the back of the roof of your mouth. Its position is subtly connected to your tongue position.
Pelvic floor, diaphragm, soft palate. How do they work?
They're dynamic, not static. They tend to rise up into a dome shape on the exhale and flatten or widen slightly on the inhale. Their muscle fibers connect front to back, side to side, forming this strong, integrated 3D support structure for your core.
They suggest an exploration for the top dome, the soft palate and tongue.
Yeah, a simple one. Gently rest the tip of your tongue on your soft palate. As you inhale, see if you can subtly sense the soft palate maybe widening or flattening slightly into the space where the tongue rests. As you exhale, sense it gently lifting or doming upwards, mirroring the diaphragm's action. It helps you recognize that subtle link between your often unconscious tongue habit and this upper dome's activity.
And how active these domes are can vary between people.
Absolutely. Singers or chanters might have a very conscious relationship with their soft palate and diaphragm. Others might not. The idea isn't to force one way, but to recognize how they function in your body, appreciate their role, and see how understanding the anatomy can be applied practically for, better support and overall health. Exploring all three together offers really powerful integrated support.
A daily life reflection using the domes.
They suggest thinking about the pelvic floor dome with climbing stairs. Instead of just tensing your abs, try to recruit a sense of that pelvic floor hammock actively supporting your pelvis from below. Let that base dome provide a feeling of lift and support for your whole body as you move up.
Okay, now to the area everyone thinks of for strength, the core muscles, titled power.
Right. And core support is really a team effort. It involves skeletal alignment, that tripod in the feet, head balance, plus the stability from those muscular domes we just discussed. But yes, the abdominal wall muscles are definitely a major source of dynamic power.
In yoga, this connects to Uddiyana Bandha, right? The abdominal lock.
Exactly. Uddiyana Bandha is a practice specifically aimed at engaging that central support from the abdominal wall muscles. And that wall has 4 layers of flat muscles working together.
Okay, what are the layers?
Deepest is the transversus abdominis. Its fibers run horizontally, like a natural corset or girdle, wrapping from your back around to the front. You feel it when you cough hard. It actually links with the diaphragm, helping with exhalation, but gripping it too tight can restrict your breath.
Okay, the deep girdle. What's next?
On top of that are the internal and external obliques. Their fibers run diagonally, crossing each other. They attach into the linea alba, that fibrous line down the middle, separating the six-pack muscles. These obliques are key for side bending and especially twisting, providing rotational power.
Like swinging a bat or throwing.
Precisely. And then the most superficial layer is the rectus abdominis, the six-pack muscle. Its fibers run vertically from your sternum down to your pubic bone. Its main job is flexing the trunk, like in a crunch or sit-up.
So horizontal, diagonal, vertical layers all working together.
Exactly. That combination gives incredible potential for powerful movement lifting, carrying, supporting the trunk in all directions.
How can we feel this core support? An embodied exploration.
They guide you to find your sternum, feel the top part, the main body, the pointy bottom tip, xiphoid process, and your pubic bone. Now, gently flex and extend your torso a little, just sensing the changing distance and relationship between the bottom of your sternum and your pubic bone.
Okay.
Then, try to visualize your xiphoid process and pubic bone aligning in a more or less straight vertical line. Consciously finding this skeletal alignment helps provide dynamic postural balance and lets you recruit the abdominal muscles more effectively and efficiently. Habits of always being curled in or arched back hinder that optimal muscle use.
Let's take this into plank pose, Phalakasana. How does it apply?
Okay, holding plank. First, recognize your position. Connect your skeletal alignment. Balance your head. Find that line between sternum and pubic bone. Connect to your foundation. Visualize the tripod in your hands, your feet pressing back. Then, feel the muscular action. Yes, your arms and legs are active, but also feel that central girdle. Recruit the support from the horizontal transversus abdominis wrapping in, the diagonal obliques stabilizing, the vertical rectus abdominis maintaining length. Release any unnecessary tension in your neck or shoulders.
So it's not just about brute strength, but integrated, layered support.
Exactly. It's not just about the six-pack. True core power in dynamic movement comes from understanding and visualizing this whole system working together, engaging all these layers mutually.
All right, finally, let's move out to the limbs, the arm. The chapter is titled Flying.
It's a great metaphor, isn't it? Thinking of arms as wings, especially for arm balances or just bearing weight on your hands. Understanding the arm and shoulder structure is vital for building stable support, whether it's a simple tabletop or a handstand.
The shoulder girdle itself is quite complex, multiple joints.
Yes. 3 main joints connect the shoulder girdle to the torso. You can actually feel them. The sternoclavicular joint, where your collarbone, clavicle, meets your breastbone, sternum. This is the only bony connection of your whole arm and shoulder to your main skeleton.
Wow, just at one point.
Yeah. Then trace your collarbone outwards to the acromioclavicular AC joint, where the clavicle meets a part of your shoulder blade called the acromion process.
Okay.
And then the main shoulder joint, the glenohumeral joint, that's the ball and socket, where the head of your upper arm bone, humerus, fits into that shallow socket glenoid fossa on the shoulder blade. Just feeling your collarbone, sensing its width, can help you visualize broadening across your upper chest.
And that ball and socket joint, the glenohumeral, has amazing range of motion.
Incredible range. 7 basic movements. Flexion forward, extension back, abduction away from body, adduction towards body, medial rotation, inward, lateral rotation, outward, and circumduction, making circles. And the shoulder blade, the scapula, moves too, right? It's not fixed.
Oh, absolutely. The scapula slides and rotates all over your upper back. It has 6 main movements. Elevation, shrugging up, depression, pulling down, protraction, moving away from the spine, like reaching forward, retraction, squeezing towards the spine, and upward and downward rotation. Upward rotation is when you lift your arm.
Exactly. As you lift your arm overhead, the scapula has to rotate upwards, the bottom tip moves out and up. As you lower the arm, it rotates downwards. Feeling this connection, recognizing how shoulder movement depends on scapular movement is key.
They mentioned some common yoga cues about shoulders. Squeeze shoulder blades, roll shoulders back.
Yes. Cues like squeeze shoulder blades together, roll shoulders back and down, press shoulders away from ears. They acknowledge these can be helpful sometimes, maybe in a back bend or releasing neck tension, but they caution that overcorrecting or doing them habitually without awareness can actually create strain in the shoulder blades or neck.
And connecting the core, the spine, back to arm movement is crucial.
So crucial. Try this. Sit and just deliberately slouch. Hunch your back, let your head drop. Now try to lift one arm straight up overhead. Feel the restriction.
Yeah, definitely limited.
Okay, now release that slouch. Recruit those anatomical alignment points. Balance your head at the AO joint. Find that sternum-pubic bone connection. Realign your central axis. Now try lifting the arm again.
Wow, much easier, more range.
Right. It clearly shows how poor posture or imbalances in your core and spine directly limit your arm's freedom and action.
What about the big muscles connecting the torso to the arms?
Two major players are the pectoralis major across your chest, forming the front of your armpit, and the latissimus dorsi, that huge, broad muscle covering much of your back, forming the back of the armpit. They work together, connecting and supporting the trunk and arms.
Pecs and lats.
Right. Pec major helps flex, adduct, and medially rotate the arm. Latissimus dorsi starts way down on the sacrum and spine, spirals around to attach to the front of the humerus. It's powerful for adducting, extending, and medially rotating the arm, and even helps with twisting. It's a massive connector between the axial skeleton spine and the appendicular skeleton arm.
And below the elbow, the forearm.
You've got the elbow hinge joint itself between the humerus and the ulna, then the two forearm bones, radius and ulna. The key thing here is the radial nard joint, which allows that crucial rotation pronation, palm down, and supination, palm up. The radius bone has a round head near the elbow, specifically designed to pivot and allow this rotation.
Okay, let's apply this to low plank chaturanga dandasana. How can this awareness help?
They suggest starting in tabletop first, really establishing your hand foundation, visualizing that tripod balance in your palms. Then, as you transition to low plank, recognize your position. Instead of just fixating on keeping elbows tucked, try applying imagery for stable support. Sense the integrity of your forearm bones, radius and ulna. Recruit support from your whole shoulder girdle. Feel the connection at the AC joint, the sternoclavicular joint. Feel the integration of pec major and lats connecting arms to core. Release unnecessary tension, maybe in your neck or face. It's another way to find balance and efficiency in a challenging pose, offering a different perspective.
And for people with joint differences, like hypermobility.
Yeah, they touch on that, referencing things like the Baton scale from earlier in the book. If you know you have hypermobile elbows that tend to hyperextend or lock back when bearing weight, recognize that. Release the habit of locking the joint. Instead, recruit a tiny microbend, a sense of active muscular support and length, rather than just hanging on the joint ligaments. If you're less mobile, recruit the feeling of length and explore your available range safely. It always comes back to finding stability and potential within your unique structure.
Any final daily life reflections for arms and shoulders?
Just notice, how are your shoulders and arms positioned when you read, type, use your phone? Are you habitually slumped, rounded, tense? Apply the 4 Rs. Recognize the habit. Release the grip. Recruit a sense of ease and better alignment. Maybe use that sternum-pubic bone connection. And restore a more comfortable way of sitting or standing. They suggest a simple experiment too. Cross your arms your usual way. Notice which arm is on top, how your shoulders feel. Then deliberately cross them the other way. Recognize the difference, the preference. It just highlights those ingrained habits and opens the door to choice.
Wow. We've really traveled through the body, haven't we? Using this lens of functional awareness, reflective practice, from the feet all the way up.
It's a really powerful way to explore, emphasizing recognizing your own structure, your habits, releasing tension, recruiting new ways to move using anatomical insights, and restoring towards that dynamic balance.
Not a fixed goal, but like that quote, a way of traveling.
Exactly, and finding more ease, more resilience, more vitality along the way.
They end with that beautiful quote often attributed to Rumi. You were born with wings. Why prefer to crawl through life? It feels like a perfect summary of the potential here.
It really does, encouraging us to tap into that inherent potential.
So to help bring a bit of this awareness into the present moment, let's just take a minute for a seated reflection, drawing from the book's guidance. If you can, find a comfortable seat. Let your body and mind quiet down a bit. Just sensing, without judging.
Okay. Start by just acknowledging your contact with the chair or the floor. Recognize where you connect. Can you sense any areas where you might be holding tension, maybe holding yourself away from the support? Just notice.
Now, gently bring your awareness to the tripod of balance in your feet, even if they're just resting on the floor. Notice if weight favors one point or side. Softly recruit a sense of more balanced distribution through those 3 points on each foot. Restore a feeling of stable grounding.
Shift your awareness up to the balance of your head, right at the top of your spine, that AO joint. Recognize its position. Is it tilted, forward, back? Gently. Release any tension you notice in your neck, your jaw. Recruit a feeling of effortless balance, like your head is floating lightly. If your eyes are open, let them receive information softly rather than reaching forward.
Now notice your breath. just breathing easily. On the exhale, consciously fish, release any lingering tension. On the inhale, just sense the body's natural response. Recognize your breathing pattern right now. Gently bout it. Recruit a way of breathing that feels easeful, resonant for you today.
Gently bring your awareness to the relationship between your pubic bone at the front of your pelvis and your breastbone, your sternum. Just recognize how they relate in your current posture. Release any habit of collapsing or overarching. Recruit a sense of length and integrated support along this central line. Restore your posture with a feeling of integrity, just for this moment.
Bring your awareness back to those key landmarks. The balanced tripod of the feet, the easy balance of the head, that dynamic connection between sternum and pubic bone. Take a full, easy inhale and exhale, sensing your whole body present in the space.
Now, gently let your awareness expand outwards. Sense your body in the seat, in the room you're in, the building. Maybe even sense your connection to the town, the country, the planet. Receive the light, the sounds around you, while staying connected to that inner sense of balance. Let your breath support this awareness.
And as you transition out of this brief reflection, maybe you move or stretch or stand up. See if you can carry just one small part of this experience, a sensation, a thought, a feeling of ease forward into the rest of your day. Align your action with this inner awareness.
It really is those small, consistent moments of awareness that create significant change over time.
Absolutely. Which brings us perfectly to our final thought for you today. How might bringing mindful awareness to just one small, seemingly insignificant daily action? Maybe how you stand waiting in a queue or how you hold your phone while you're scrolling. How might that subtly but profoundly reshape your physical experience and your potential over the coming weeks and months?